Well, a warm welcome to this talk. And like many of us, I've actually been ill for the past week or more. I suspect I may have had human metapneumoniovirus, but more on that in a minute. Now, we do have a lot of winter viruses around at the moment, of course. And I want to run through my symptoms and tell you how I worked out what I suspect the diagnosis is and roughly what my management strategy was. So let's look at that now. So if we just start off with me, and this is something you can all relate to really quite easily, I'm sure. I had a minor sore throat for about 3 days. So, you know, we get this from time to time. You think, oh, a bit of a sore throat, hopefully it won't come to anything. And a lot of times it doesn't. So very minor sore throat for probably 3 or 4 days, actually, to begin with. That was the first feature I was aware of. And then sore throat got much worse for 2 or 3 days. And then I developed the fever. And it was actually quite high, about 38.5 degrees centigrade, which is about 101 degrees Fahrenheit. Now, the high fever part didn't last for very long, but when it did, I felt really quite ill with that. When you've got a high fever, you release inflammatory cytokines, which is good. That's what puts your temperature up. It affects the hypothalamus, increases the body temperature. That optimizes the efficiency or increases the efficiency of the immune system. So that's all good. And it also makes you ill. So it really forces you to rest. So you can't go around exercising when you're ill because that's dangerous. So it does make sense. And it's actually a good thing. So pretty ill for those 3 days. Then quite bad nasal symptoms developed. And then with me, the fever persisted for about 4 days. Much lower grade fever for about 4 days. It went down from about 38.5 to about 37.5, 37.4. But it was definitely there, and I still felt a bit off with the lower grade fever. And that lasted for 4 or 5 days as well. I was surprised actually how long that fever lasted for. Typically, the fever, the pyrexia, the high temperature only lasts for a few days. But with me, it lasted for quite a while. And then the productive cough started. Now, the productive cough, of course, is good. It means your mucociliary clearance system is getting all the stuff up from your lungs, and you can feel yourself coughing things up. And then the mucus started as well. Now, in the initial stages of the infection, the mucus was white, and then as time goes on, it goes green. Sorry, it's all quite unpleasant, but you're familiar with this. It goes green, and the green means it's older. It actually means the immune system, the nasal systems, and the respiratory systems are working well. The green is caused by some dead bacterial cells, dead viruses, dead white blood cells, some cell fragments from the surface of the respiratory passages, and the mucus itself that's gone green with a bit of age. So the green mucus, in a sense, is good. It's clearing the respiratory passages, clearing the sinus, and the sinus is the air spaces in the skull. And that's actually a good sign that you're clearing that. If patients can't cough and can't clear that, it's really bad. Now, my cough was not an irritating cough. It's not like, oh, I need to cough all the time, like with COVID. It wasn't like that at all. The cough was purely to clear the secretions. And I wasn't really sneezing much either. But more on that as we go through. So productive cough, which is good. Nasal clearing, mucus turned green with time, which is healthy and normal. Now, this is actually a table. It's based on NHS data, and it tells you the relative symptoms. Now, a green tick means the symptom is likely to be present, not guaranteed. No disease follows all the textbook criteria. The cross means it's less likely to be present. So quite interesting. Let's have a look at this now. So first of all, you think, do I have COVID? So fever, cough, headache, sore throat, runny or blocked nose, sneezing. So I wasn't sneezing. Aches and pains, not really much aches and pains. But the key thing with COVID is I had a completely preserved sense of smell. And I've also had COVID a couple of times, so I think my immunity to that's probably fairly good. So I didn't think it was COVID. It didn't quite match for flu, because in flu you're less likely to get a runny or blocked nose, and I did certainly have a runny and blocked nose. RSV, Again, I didn't think that was too likely for various reasons. I could go through all these now, but it would take a long time. So I was left with what I suspected was this human metapneumonia virus, HMPV. Now, it turns out this virus has been around for a long time. It was first identified in birds in the 1970s. It was identified in humans in the Netherlands in children in 2021. So it's one of the endemic viruses. And we will do more on this in a minute, because I'm not too worried about a new HMPV pandemic coming from China, but I can explain that probably in a subsequent video. But let's carry on with this current line of thinking. So going through my symptoms here, fever, yes. Cough, yes. As I say, the cough wasn't an irritating cough, but it was one that was there to clear the secretions. Headache, no. Sore throat, yes, I had that. Runny or blocked nose, yes, I had that. Sneezing, no, I didn't have sneezing, so that's consistent. I think I sneezed about twice in the whole period in the whole week. Aches and pains, limited. I did have some limited ones at the beginning. Fatigue, I was tired, but not undue fatigue. More, I didn't want to do any exercise. Loss of taste or smell, that wasn't present. Shortness of breath, well, I didn't really exercise, so I didn't really find out. No diarrhea, no vomiting. So quite a useful table, that. If you look through that, you can kind of work out what condition it's most likely that you probably have. So quite interesting and quite useful, that. So what did I do? How did I manage myself? Well, I can tell you a little bit about how I manage myself. Let's look at that now. So clearly you need to rest. I gave myself light nutrition because protein is important. Protein, of course, is important to make the antibodies, the immunoglobulins. I also took few grams of extra vitamin C, a gram a day for a few days. As long as you're drinking plenty, that won't do me any harm. I also took some zinc. I actually take zinc regularly anyway. I take 50 milligrams of zinc a day for my, it's good for prostate issues. So I take that. So I was taking that anyway, but zinc does have antiviral properties, some antiviral properties in the intracellular environment. Dilute iodine gargles, so Lugo's iodine 15%. Just put a little bit in a glass. Keep going to the wrong camera. There we go. Just put a little bit in a glass, dilute it so it's very dilute. Gargle with it several times a day. The evidence for how effective that is limited, but we do know that iodine, if it comes into contact with any virus or any bacteria, will kill it. So it seems quite a reasonable thing to gargle with iodine. It will also increase your iodine intake to some extent as well. I took some extra Calcifediol, which if you've watched the videos with Dr. David Grimes, you will understand. I also avoided antipyretics. So antipyretics, and I kept warm. So antipyretics are drugs that reduce fever. Aspirin, ibuprofen, paracetamol, Tylenol, acetaminophen. Tylenol, paracetamol, acetaminophen, Panadol are all the same thing. It's just different names in different countries. But what these drugs will do is they will artificially lower your temperature. And of course, if you artificially lower the temperature, you feel one heck of a lot better. But the immune system works best at pyrexial temperatures. The pyrexia, the fever, is not there for side effects of the virus. It's that the body deliberately induces that. And so I left my fever as high. I just let my own body course follow through with that. And I believe that shortens the course of the infection. But keep warm's good. Keep well hydrated, because keeping warm keeping warm's good for the immune system. And keeping well hydrated means that if you're dehydrated, at least the mucus becomes thickened. And that means it's harder to clear your secretions, which of course is bad. So I think in the next video I'll go on to tell you a little more secrets about what I did, and we'll also go on to look at a little bit about the human metapneumonia virus that's currently rampant in China apparently, but more on that. More on that in the next video. We'll just leave it that as a short update from me. I am feeling much better now, but still, yeah, bit to go yet. But that's where we are at the moment. Many of you are in the same situation, so do get better soon. But for now, thank you for watching.